Welcome to today's episode of the Medical Fitness Podcast, powered by the Medical Fitness Association and MRF Institute. My name is Thomas Hammett. I'm the Director of Operations for Pinnacle Lifestyle Medicine and the co-founder of the Medicine Rehab and Fitness Institute. My co-host today is my friend and colleague Jeff Young, kinesiologist and co-founder of the Medicine Rehab and Fitness Institute. Hey there, Jeff.
Hey everyone, we are excited to have Dr. Rachele Pojednic with us today on the podcast. Rachel is the Director of Scientific Research and Education at Restore Hyper Wellness, an adjunct lecturer at Stanford University, and the Director of Education at Stanford Lifestyle Medicine. In addition, she serves as a research associate at the Institute of Lifestyle Medicine at Harvard Medical School and is an award-winning instructor at the Harvard Extension School. Previously, she was a tenure-track faculty member at Norwich University and Simmons University. For the past decade, Dr. Pojednic's work has examined nutrition, supplementation, and physical activity interventions on muscle physiology, performance, and recovery, as well as muscle-related chronic disease. She has a really incredible educational website, rachelepodjednic.com, which we will put in the show notes. This is really just the tip of the iceberg on Rachel's background. So, Rachel, thanks for joining us. And to help us get started today, can you share more about your backstory with our audience?
I sure can. Jeff and Thomas, thank you so much for having me. Super grateful to be talking to you both today. We have so many different professional, I think, and personal interests that are in alignment. I think we've got a lot to cover here today. So, just a little bit of background about me. I have always straddled the two worlds of academia and fitness and wellness. So, if you look at my CV, you can see, I've got all of these schools that I have worked at and taught at and the research that I've done, but consistently through all of that time, I have been a member and advocate of the fitness industry. And the thing that I have noticed about these two spaces is that they don't talk to each other very often. And so my goal, my mission in life perhaps, is to bring these two worlds together. And so throughout the years, I've done three sort of major pockets of work. The first is looking, as you mentioned, in supplementation and skeletal muscle for both human performance and healthy aging. So I study sarcopenia and diseases like type 2 diabetes, which are really related to skeletal muscle. I also, as you mentioned, am a big advocate on education. And I work to make sure that our healthcare professionals, particularly doctors, nurse practitioners, physical therapists, have as part of their core education information about exercise and nutrition and these lifestyle therapies that we know are so important for disease prevention and treatment. And I also work in making sure that people, real people, are able to perform and live a long and healthy life. So the past couple of years, I've really focused on a different couple of different populations to help them age well and perform out in the field. So I've done some work with war fighters, specifically looking now a little bit more at women's health. And as you mentioned in my bio, I have transitioned partially into the wellness industry, and I have directed for the past 2 years, Restore Labs, which is looking at a lot of nutrition and complementary therapies for healthy aging and performance. So, really sort of run the gamut on how we can get people to age well and perform long into later life.
You know, one of the things I was thinking about when you were speaking of your background is uh, exerkines and organ crosstalk, and actually how it relates to just systems in general. And we need to get systems talking to each other to improve, right? To improve the whole system. So that was definitely one of the things that popped in my mind. But just for the listener's sake, the overall topic for today, which who knows, we may veer from things depending on how the discussion goes, but the overall topic is muscle as medicine, strength training for health and longevity, based on Dr. Pojednic's research. So we have a list of questions for her. I'm really excited to dive into the discussion, and I'm going to ask the first one. Why is muscle considered a key organ for health and longevity? And what role does it play in metabolism and chronic disease prevention?
Yeah, this is such a good question. And I have to say, I'm totally biased, but I'm right. Muscle is the tissue of longevity, right?
That's it.
So When I started going down into this field, it was really popular to be studying cardiovascular health. So it was aerobic exercise 20 years ago, and people were really interested in making sure that we were preventing cardiovascular disease and the other diseases of our time, utilizing mostly aerobic types of exercise. And we were just starting to get flashes in the literature of how important things like resistance training were. And when I was sort of shopping around for a grad school mentor, I remember being turned away from many different labs saying, why are you interested in muscle? Like it's really just a tissue that's important for movement and, for making sure that you are able to catch yourself when you fall down later on in life. And I was like, no, I think there's something more going on here. And, there was amazing sort of seminal work happening in a lot of different labs at the time that just wasn't competing well with the aerobic exercise work. And I was really lucky to find at Tufts University the nutrition, exercise physiology, and sarcopenia lab with Dr. Roger Fielding. And so when we started to look at that literature, he was doing some really amazing work on protein supplementation and power. And what he was looking at, and I got looped into, was working with people that were in their 80s and 90s and doing power training with them.
Real
Now,
real quick, was Bill Evans there at the time?
he wasn't there at the time, but we
Okay.
were sort of like tightly wound with that. Yeah.
Okay, keep going. Sorry
Yeah.
about that.
So, when we were looking at power training, I remember the very first time I walked into this lab and I was like, I'm home. They had all of these 80 and 90-year-olds on like the big like leg press sleds that you
Exactly.
see at the gym, right? And there were these trainers there and research assistants that were standing next to these like 80, 90-year-old women, like little, our grandmas, right, are on this sled and they're like, 1, 2, 3, go.
I
And this,
love it.
90-year-old woman is just pushing as hard as she possibly can against this sled. And I was like, this, this is what is so important. And as I started to go into more of my studies and more of the research, we started realizing how critical muscle is as a source of fuel metabolism. So things as simple as getting sugar, glucose out of our system and looking at, if you want to go down the sort of intricate pathway of how exercise is going to get GLUT4 to the side of the cell
That
independently of the insulin receptor. When we look at utilization of fat so that it doesn't accumulate in that muscle and start to degrade it, utilizing it as a fuel, all of these things we started to realize, oh, hey, this is way more important than just, bending your elbow or catching yourself when you fall down. This is a tissue that's critically important to metabolic health in the long term. And that's where I really got started. And that's where the literature has driven, very fast in the last 20 years is everybody finally is talking about how critically important it is to build and maintain skeletal muscle as you age. And it's well beyond just being strong. It's really important for making sure that your overall metabolism, inflammation, all of these diseases of our time are held at bay, and muscle is the tissue that's going to do that.
I'm gonna chime in. I'm gonna butt in and chime in and say that this is what you just said, or part of what you just said is so helpful for me and the classes that I teach. And I guarantee you, I'm going to take a little excerpt and show my students. And you reminded me, it's 1995, I think, and I'm sitting in a biology of aging class at Penn State University undergrad. And Dr. Bill Evans was not the instructor for that class, but he was the director of Neurophysiological Research Lab at Penn State. It was a world-class research facility. He came in and he guest lectured a couple times. So it's 1995, I think, and I don't know, exactly what studies you're talking about, but he came in and he was talking about landmark studies that they had done, and if I remember correctly, one was in 1985 or 86, and the second one in 1990. The first time doing high intensity resistance training in frail institutionalized nursing home patients with ages like you just mentioned. And the first one I think was knee extension was the only exercise, and the next one was leg press and knee extension. And they were taking on muscle failure and blah blah blah. And you either saw that or you were doing the same thing. And when it's bullet points on a screen for my students, they just don't get it. But when you really see that and understand the magnitude that, and I am always using those things as a reference that, hey, and obviously it's not just that they were the oldest of the old, but um the comorbidities that come along with it, whether it's cancer survivors or hypertension and et cetera, et cetera. And so yeah, that's really exciting to me and really cool that you got to be in the lab experiencing that. And one other real quick thing I'll say for I let Thomas chime in since I'm butting in here is even things like GLUT4. I wish that we had time to talk about things like that, which obviously we don't, but it's just so critical to understand some basic physiology like that. And when you understand those things, then you really it starts to become that much more clear why muscle is so important. Okay. So now this GLUT4 is migrating to the surface and it's doing the job of, and ultimately helping insulin sensitivity and things like that. So I love um, the things that you're bringing up, and wish we did have 2 or 3 hours that we could talk today.
We'll have to do another one. We'll go into deep in the
Yeah,
physiology.
let's do it.
I just have to say it was really refreshing to hear how much you used the word sarcopenia. But in my situation, I spent a lot of time in the clinical setting, so I'm not spending a lot of time in the research world. But out in the clinical setting, I think sarcopenia is so both under recognized, under screened for, and even underutilized as a clinical indicator of someone's potential longevity. And the two applications, first, actually, it's really cool to hear your experience in the tough sarcopenia lab. It actually reminds me a lot of what Dr. Robert Newton shared with me a couple weeks ago. He's working with patients that have low to no testosterone or undergoing chemotherapy, the people that you would think of being frail due to chemical reasons, and doing very similar exercise. And I think the assumptions that we make is that people in that situation can't do that kind of activity, that there's safety risks and reason to not do so. And maybe I would love to actually ask you briefly if you could touch on how that specific experience, how that's been proven to be safe and done in a safe way, and maybe even some of the strategies you use, because I think that's probably really hard to picture for someone who is trying to understand how that can be performed. So maybe I'll stop there and ask, like, what was done in that setting to make sure that that was safe for those participants that were going through the exercise?
Yeah, it's a great question. So, we're all sort of trainers, and you're a PT, Thomas. So I think one thing that's got to be really clear is that we didn't put my 90-year-old grandmother onto the sled and the day that she walked in the lab and tell her to push as hard as she could, right? So there is this idea of progression with muscle, and that progression is going to be critical whether you are 18 years old, 38 years old, or 88 years old, right? If you are new to doing this type of work, this type of physical work with your body, you have to build up to those, high intensity type of efforts. You would never put somebody into that situation that's never done something like that before. So that was really cool in this lab, is that we would literally, at the same time that we've got our 90-year-old grandmother on the sled, we would have people that were new to our studies just doing laps around the lab, right? And so they could all see each other and sort of create this community of not only fun socialization, which was hilarious, by the way, back in the day, but also of aspiration. And so, a question that I think a lot of people in our space get, especially if we're thinking about sarcopenia and older folks, is it too late? And the answer is no. The data is quite clear that it is never too late. Your muscle is always going to be plastic. It's always going to be trainable. You might not be as strong at age 88 as you were at 18, but you can certainly be stronger at 88 than you were at 87 if you were feeling like there was deficits there, or potentially a diagnosis of sarcopenia. And so we, as our research associates, as our trainers in the lab, were very well trained to work with this specific population, um, which honestly brings me to another population that I've been working with as well, that's really popular in this space of lifting bigger and heavier weights, is women are finally getting onto this train as well. Where, back in the day in the sort of like 80s, 90s, early knots, it was like, oh, women, get on your elliptical machine. You don't need to be lifting heavy. You don't want to be doing things. No, no, no. My 90-year-old grandmother would have really appreciated if somebody had told her when she was 18 or 28 or 38, get under a bar, like get some dumbbells, do some kettlebell swings, right? Because she was compensating for a deficit that had sort of manifested for the last 70 years. Was it too late? No. Should she have been doing it at 18, 28, and 38? Hell yes. So we want to be looking backwards too and making sure that we're not leaving different populations out from this space. Because as you mentioned, Thomas, once you get to a position where you're 60, 70, or 80, and we're missing diagnoses of sarcopenia, that is a whole host of downstream metabolic, osteoporotic, disease risk from all of these diseases of our time, just simply because we haven't literally built up the bodies of younger people.
Yeah, it's such a good segue to the next question I wanted to ask you. And you had mentioned one of these things, which is that I think there's assumptions about what women are interested or willing to do from an exercise standpoint. But I'm curious what other challenges women face when it comes to building and maintaining muscle and even getting started with that kind of exercise, especially in midlife and beyond.
Yeah, I love this question. And I also love the fact that finally, there is some data coming out about this group in the literature. So, a devastating fact about female data in the performance, muscle, longevity space is that on lowest count, 6%, and on highest count, somewhere around 18% of the data is done in women alone. So we have a massive absence of evidence of performance literature in females. And this is across the lifespan. It gets even worse when we look at peri and postmenopausal women and that menopausal transition, because as it turns out, studying hormones is hard. And so we just didn't do it for a long time, right? That was kind of a cop out. And so finally, we've got some, new and emerging data for women, where it used to be like, oh, women can't build muscle, and oh, they can't build muscle at certain times of their menstrual cycle, and oh, they can't build muscle postmenopause. And as it turns out, none of that is true, which is
Love it.
so exciting.
Yes.
So there is probably 4 or 5, maybe 6 or 7 papers that have come out just in the last year or so that basically show if women strength train hard and they're doing the work in the gym, their muscle is going to get stronger, more robust, more metabolically resilient, and it doesn't look any different than men's, short of some tiny sort of broad stroke changes. Women tend to have a little bit more type 1 endurance fibers. Men on average tend to have a little bit more type 2 power fibers. But you guys know this from the training literature, is that your body is going to do and respond to it the way that you train it, regardless of sort of where that characteristics lie. And this is really exciting, Thomas. In the past, probably month or so, there's been a couple of studies that show postmenopausal women. So this is when women's estrogen levels goes to basically zero. We are also not seeing a major deficit in the ability of muscle to be rebuilt. Estrogen, we know, is very anti-inflammatory. It's also anabolic in women as well as men, although testosterone tends to lead for men. We see that transition also does not lead to deficits in the ability of the muscle to strengthen. And so this is why it was so effective for my 90-year-old woman in our lab way back in the day, is that her muscle was responding. And we finally have some data to show that this is pretty impactful for women over the lifespan.
I would like to respond if you don't mind. As you could probably imagine with the story of my wife, which I know Thomas knows, and you probably see me posting on LinkedIn, Rachel. And I know she's just a sample of one, but it aligns with this. And yeah, I'm trying to think, 2.5 years ago, she had a planned non-emergency total hysterectomy. And so she went from peri to post, right? And and she has multiple sclerosis. So when she first was diagnosed with multiple sclerosis, which is now about 21 years ago, and I didn't know the things that I know now, and I was scared to put her on a program at all, let alone a progressive program. But then, flash forward about 5 or 6 years and learn more, and uh, some positive things were happening with her changing her diet and stuff like that, and feeling a little bit better. Put her on a program, and now with my videos that I post. She's almost getting ready to turn 49. She's 5'4" and weighs 130 pounds, and she's deadlifting over 300 pounds for reps. She's squatting over 200 pounds for reps. She's chest pressing 45, 50, 55-pound dumbbells, etc. But the main thing I'm actually leading to is that having that surgery didn't change anything. It set her back, significantly set her back for about a year, but then she caught right back up, and she's actually now a little stronger than she was pre-surgery. So, and I don't train her any different than I would anyone else. I make sure that it's RPE based. I make sure that it's auto-regulated based on how she's feeling from session to session, and we'll adjust accordingly and stuff like that. But otherwise, it's still total body. I know I'm throwing some jargon out there, but it's periodized in the sense that we'll have our lighter and our heavier days and higher reps and lower reps and stuff like that. But anyways, I just love the fact that you said what you said, and I'm curious. Um, do you have any thoughts on what I just said? Whether you agree, disagree, any thoughts at all?
Yeah, I 100% agree. And I love seeing those videos, by the way, when you post them. It's so inspirational and aspirational for so many women, not only because your wife has overcome so many physical challenges with MS and with surgeries and everything else, but also just the fact that women can be super strong
Yes.
and that there is a shift in mentality here where women for so long were told be smaller, be smaller, be smaller, be thinner, only do aerobic exercise. We are seeing this major social shift into women need muscle, women need to make sure that they are strong and capable of moving their body in multiple planes of motion, being able to jump and catch themselves and land and all of these things. And so I get really excited because this is something that I think all of us in this space have probably, if not overtly, at least sort of like subconsciously advocated for, that like we want people to be as strong as they possibly can as they age,
Yes.
regardless of whether they're female or male. But that for women, for the longest time, it was not socially, you know, palatable to do these kinds of, extreme types of lifting programs or, you know, getting muscle on their body. Um, I see it still, it kind of drives me crazy. I see it still in this world for mostly younger women, which it drives me nuts, where there's all this hype right now about training around your menstrual cycle, right? Where it's like, oh,
Yes.
in some phases you should be doing really hard work, in some phases you should be doing nap yoga, and like god forbid you do, you try to hit a PR in your luteal phase, right? I put uh, a newsletter out about this the other day. I get so angry about this because I'm like, if the luteal phase, which is kind of like the second half of the menstrual phase, is supposed to be when we're, relaxing as women and doing, nap yoga and gentle exercise, we're missing half a month on this training that we should be doing. It seems so like unconsciously patriarchal to be like, "Oh, women, you're not strong enough. You gotta relax during this time of." Hell no, right? Like, come on, like our bodies are responsive to external stimuli and external stress and strain and, all of these things that exercise does for us in the same way. And that's where the data is starting to show this. So, like, thank you for posting these pictures, to you and to your wife, for showing how impactful this can be, even in moments of physical challenge.
Rachel, thank you for your passion about this, because as a male, no one's going to listen to me. So I love now I have this in, recorded and so I love it. I really appreciate your passion and it just makes me realize how lucky I am that back in the Penn State days and Dr. Kramer and that study I was involved in, which women were the subjects and I was involved with the power group who was training heavy and explosively and all that stuff and just blown away by the strength and power gains. Yes, all total body, but particularly in lower body musculature. And it was done for the United States Army war fighters, and I had just gotten out of the Army, so I had that comparison, right? And I was like, yeah, this is great. So what an amazing way to start my career to realize that exactly it doesn't matter where you are in your phases, you can and should just train and
Yeah, totally.
really appreciate your passion.
I get I usually use, different four-letter words when I am talking about this, so I'm trying to filter myself a little bit, so it's passion, filtered passion right now.
Love it.
I can really appreciate. I'm really glad you brought up the social element of this, Rachel, because I think even talking with female patients about this, it's clear that there's an understood way that you're allowed to look or things that you're allowed to do as a female. And it's really hard to get past and even into the complexity of all those things that are allowed, I guess, from a social standpoint. And I think that's really just one of like the set of misconceptions that can happen around strength training, particularly for women. And I'd love to jump just to that, like that broader theme. What are some of the biggest misconceptions about strength training, and particularly for women in aging populations, but just generally as a whole too?
Yeah. I think one is I'll tap into again is a lot of women, especially in sort of midlife, often will think it's too late for me, right? And so I think that's one misconception that needs to go completely away. But along with that, what I think is a social component of that, as you have tapped into, is women in midlife that have not done this before will go into the gym and they feel incredibly intimidated by what is going on around them, right? So they have, for the most part, been socialized to use the cardio equipment part of the gym and stay away from the racks and the big weights. And so even walking into that space can feel really intimidating. And I would also argue that if you walk into that space and you see a bunch of really muscular women doing chin ups and pull ups, like I'm super jazzed for that. Like, keep going, ladies, like, keep doing your chin ups and pull ups and really heavy weights. It can often be really intimidating for a woman that's not done that before to walk in and be like, oh, I'm never going to be there. I'm never going to see that kind of muscle. And a lot of times, because we've been socialized to be small and not muscular, they will often look at that body type and say, I don't want that. Right. And so we're combating a lot of, I think, misconceptions in the female space right now. So just to sort of like recap, one, it's too late. Two, I'm intimidated. And three, I don't want to look like that. And so I think one thing that I would say to women is, I hope you're hearing it, it's never too late, which is very exciting. Number two, and I think Jeff and Thomas, you would back me up on this, is that finding a professional that can help you ease into this space that makes you feel really comfortable and welcome and capable is really critical. You don't need to, nor should you walk into the space with the racks and throw a bar on your back and start to, move in a way that you've never moved before. You want to get some instruction. And this is where a great trainer or a great PT can be really helpful. And then the third is every body is going to respond differently to strength training, right? And to muscle training. You can't see me, but I'm a very tiny human. It says I'm 5'1" on my license, but that's a lie. I am 5.0 on like a really good day, right? And I lift really heavy and my body just responds the way that it responds. It stays little because I am in a tiny frame, right? For somebody else, their muscles might get bigger. For somebody else, they're not going to see any change in their muscles at all, even if they're throwing 300 pounds on that bar, right? So I would say learn your body and what it is and can become. And then I would add on to this, embrace that, right? Like, embrace that. Like, screw what the sort of, social norms are. If you want to live well and long and feel really good at age 80, 85, 90, 95, who the hell cares if your muscle gets big or doesn't? Like, you're setting future you up for success. Like, nobody's going to be judging you when you are 95 years old and you're throwing a bar on your back still and you're in that weight room. You're going to feel like a total badass because you are. So I would say there's a lot of misconceptions in that space. And the first one that really just needs to be tackled is women need to learn and find a support system so that they can feel confident in this space and in the body that they can have.
What you just said spoke to me. I've in my life, I've been on two sides of the fence in the sense that for about the I'm closing in on 60, and so for about the first half of my life, I was on the side of the fence where I did care what, how I looked and what people thought of me, and I was consumed by it. And and now I'm like literally the polar opposite of what you just, I am what you just described, and what it's just mentally freeing to be on that side of the fence and do your thing and all that stuff. So I'm really glad that you brought that up as well, because I can totally relate to that. Um, hey, actually sticking with the same theme, my next question for you is, what are the most effective and sustainable strategies for building muscle at any age, especially for those new to strength training? That's a
I
good,
love this
what
question.
you just said is a good lead in to this question.
The Medical Fitness Podcast is brought to you in part by the Medical Fitness Association. Are you a professional in the medical fitness industry? As a member of the Medical Fitness Association, you'll unlock exclusive networking opportunities with top experts in the field. Access cutting-edge education to stay ahead of industry trends and best practices. Don't miss out on the chance to advance your career. Join the Medical Fitness Association today. Visit medicalfitness.org to become a member. That's medicalfitness.org.
I love this question so much. All right. So I'm going to step back from resistance training first. And I'm going to say, and I will die on this hill, doing the exercise that you love to do, that you will continuously come back to and continue to do, is the right exercise. Full stop, the end. Once you start to get into a habit of getting into exercise, enjoying it and loving it, and you want to start to build some muscle, we can think about it in sort of two different ways, right? So we've been talking a lot about resistance training, and that's going to be to increase the amount of weight that you can lift, to increase potentially the size of your muscle, but that's only half of the equation. There is a real importance to the aerobic side of the conversation as well. We know not only is strength critical for healthy aging and longevity, but there's more and more data that's resurfacing from way back when we were back in school, Jeff, when you were at Penn State, that says VO2 max and aerobic capacity is always going to be important as well. And so as we start to think about what is the exercise that you love that you will continue to come back to, it likely falls into one of those buckets, right? So maybe you are a runner and you're like, I could go out and I could run every day and I'm super happy about it, but I really dabbled in resistance training. Or maybe you're somebody that's like, man, I love getting under a bar. I love being, using dumbbells. I love that strength training, but I haven't been out for a walk or a run for a long period of time. I would say these two things have to have, if you want to optimize, if you will, which is the buzzword of the moment that we are in. If you want to optimize, having both of those things in your arsenal is probably really important. And the thing that I really like about this is that you can use them to counteract each other so that if you are, strength training really hard, use your walk or your run or whatever as your recovery, or vice versa. If you are trying really hard to, have a PR on your 5K or your 10K, resistance training can really help that, right? And so I don't think that there is a perfect way to do it. There's probably a really good way to do it to meet your goals. And running a marathon is a really different goal than hitting a PR on a squat, right? Those are going to be two really different training protocols, but you can use both of these buckets to advance whatever it is that you are doing. And at the same time, that will also help to advance your healthy aging and your health span long term.
Love it.
Everybody wants the quick and easy answer. Like, give me the protocol, right? Like, there is no protocol to life. Every person is different, every experience is different, and everybody's goals are different, and you have to modify based on that.
Exactly right.
Yeah, the do the exercise you love theme. This is actually the second time in two conversations that Jeff and I have had this conversation. The last person we were talking to is Dr. John Farrell. He's a researcher at Texas State who's talking about this with regards to adaptive athletes, and what do we do with the person who's getting discharged from subacute rehab or from the hospital, where now their resource for exercise looks a lot different, and even the way that they engage with their body is going to look a lot different depending on what they went through. And he was pointing to the next best step for a lot of people is adaptive sports, because it's something that they can enjoy, that meets their needs. And I think it's funny for Jeff and I is that we like to think of people getting into the habit of both resistance training and cardiovascular exercise. And if you just jump into one of those things, are we really meeting what we aspire to get out of our physical activity recommendations and being balanced? But the thing is, if you start with what you love, you will end up doing the other thing because you want to be fit for the thing you love. Like, you want to be in shape and capable of doing that thing you love for a long time. And I think you're so right in saying that that's the place to start for people. And if you can start from that place and gradually include more balance over time, it's such a powerful thing for people who maybe believe even now that there's not an exercise that they do love. And starting, to go back with what you were saying before, starting with a professional that can help you figure out even what that might look like if you're struggling with what that is, can be the right place to start for those people. So
I appreciate that so much, and I love the call out for working with a professional. I'm such an advocate for working with trainers, working with strength coaches, making sure that we are engaging with the people that have dedicated their life to helping us, helping you navigate this space, because it can feel really overwhelming at times, right? And I think you're tapping into something, Thomas and Jeff, that I think that is really important, which is we often think there is a right answer because we are told oftentimes, and I use the word protocol a lot, that there is a protocol for something, that there is an answer to the question that we're asking of, like, what is the perfect program? What is the perfect setup? And, we were just talking a second ago about how things change over the lifespan, right? Like, you at 18 and your protocol at 18 is going to look really different at 48, when you've got 4 kids and 2 parents that you need to be taking care of and a full-time job, and you're driving everybody around to play dates and practices and doctor's appointments, right? Like, that's going to look really different from when you're 88 years old and you've got all of these different, hopefully, amazing things happening in your day to day when you are 88. But each of those stages in life is going to require a very different protocol. And this is where I get really caught up and sort of passionate, is if we're applying the same protocol to each person in the same way, some people might thrive, but some people might feel really dejected and really disappointed when they can't live up to that exact, periodized program that's perfect, that we've got our zone 2 balanced with our, our max lifts, and we're hitting our one. And I'm just like, uh, if we assign a perfect answer, a perfect protocol, I'll keep using that word, to everyone, the majority of the people are going to fail because it's not sustainable. And I like to think about it as giving myself grace over different stages of my life, that I can, at one point I was a really good runner. I was pretty fast. And then I had 2 knee surgeries. I'm like, I'm not running anymore, but I'm a pretty good cyclist now. And they both bring me joy at different periods of my life, but that doesn't mean that I should be running again. In fact, it would probably be pretty painful. Although, Thomas, we should probably talk about that from a PT perspective. Uh, but you got to give yourself a little bit of grace between these time periods in your life, because the same protocol is not going to be effective for each individual person, and it's probably not going to be effective for you over a long time period.
Good
So yeah,
stuff.
I just went through the evolution of runner to cycling in my own personal life, and I can feel very much what you're saying there. I do want to make sure we get to this last question, because I think I would be remiss to have you on a podcast and not talk about these other factors, particularly nutrition, because we've talked a lot about muscle health and longevity, and we haven't talked so much about that stuff. So let's get into that. And really, the specific question is, beyond exercise, how do factors like nutrition, protein intake, and recovery influence muscle health and longevity?
Yeah, so critically important. I think, if there's another buzzword besides optimization that everybody's using these days, it's protein, right? So everybody's talking about protein. And we all know that it is very important. And everybody's like, oh, more and more and more and more protein is so critical. And I would say, let's be a little bit thoughtful about this, right? So we know that protein is super important. This is going to be a building block. The little amino acids from the protein itself are going to be a building block for not only muscle tissue, but also for bone, for skin, for immune cells, for all of those signaling molecules and enzymes that you have in your body. So it is critical and essential. There are 9 essential amino acids, meaning you must eat them because you cannot make them. But I think the hype is real right now, where everybody is like, oh, you got to get, 1 gram per pound of body weight, and got to make sure that we're getting so much protein. And the answer is, there's a spectrum for protein. And what we see from an sort of optimization, I'll use the buzzwords again, perspective, is that for an exercising person or an aging person, somewhere between the ranges of 1.2 to 1.6 grams per kilogram tends to be optimal for health. You can go up to about 2.2 grams per kilogram for muscle protein synthesis. And that's sort of where we see the muscle protein synthesis kind of level off. That number, if you were to do all of the conversions, is where the 1 gram per pound of body weight, so 2.2 per kilo, carry the twos, divide by 1, you end up with 1 gram per pound. So that is definitely the upper limit. And yet that is where a lot of people are reaching towards. I'm not saying that that's bad. The problem that I have seen, and I've actually been interviewed on this several times and have consulted with a lot of women, especially, is that 2 things tend to happen when we reach toward that goal. Number one, what we first see happen is that other really essential nutrients start to get dropped out of the diet, because protein is so big and satiating that we stop eating things like fiber and complex carbohydrates and all of these other essential nutrients that we know we need to have. And so we start to see weird things happen, like why do I have such GI distress? Why am I, why am I so bloated? What's going on? Well, you haven't eaten enough fiber in the last, 6 months that you've been on this super high protein diet. The other thing that we tend to see is if you supplement protein and kick out carbohydrates, we will often see performance detriments start to happen, because we know how critical carbohydrate is for physical performance, especially for things like sprinting or anaerobic efforts. You need carbohydrates on board. So with this super high protein intake, really important for muscle health, but be very careful that you're not shifting out the other things that you need in favor of these super high doses. The other thing that I tend to see happen, and again, this often happens in women, is that they're getting more and more and more and more and more protein in, and they're not balancing those calories on the other side, right? And so what we'll tend to see is that you add the protein, you add the protein, you add the protein, you add the protein, and you're still eating the Cheez-Its or munching on the popcorn or whatever. And a lot of these women will be like, why am I gaining weight and not muscle, but fat? I'm following all these Instagram influencers that tell me to keep eating more protein. And so the balance there is really, really important. Protein, yes, and make sure that you're balancing all of your other macro and micronutrients.
Yeah, you nailed it. I mean, well, obviously you nailed it because this is what you do, but it just shows nutritional literacy really needs to include the understanding of balance.
Yeah.
And just and we got three macronutrients and we got to balance them out. And so yeah, that I teach an undergrad nutrition and health course, and I'm always trying to drill this into my head. I'm sorry, into the heads of my students is, nutrition literacy includes calorie control, and it includes the balance that you just described. We unfortunately are out of time, so we need to wrap this up. And I'm going to ask you, as we wrap up, where can our listeners go to learn more about you? So we can put that in our show notes.
First, thank you so much for this super important and also really broad conversation. But I love that we can sort of like distill it back to this idea that regardless of whether or not you're a healthy older adult or somebody aspiring to be a healthy older adult, a female, a male, that a lot of the principles really apply across the board. So thanks for sort of like bringing it home there at the end. I really appreciate that because people tend to feel really overwhelmed by all of the headlines and the hype. So let's keep it simple, team, because the simple stuff, the foundational stuff is so important. To find more and hopefully a little bit more science communication, which I love to do, you can connect with me on the socials. I'm at Rachele Pojednic. You're probably going to have to check that in the show notes. The spelling is a little tricky, but you can find me on the socials at Rachele Pojednic or at rachelepojednic.com. As you mentioned in my bio, I also have a little educational company for personal trainers and for health coaches that want to learn more about how exercise and nutrition overlap. And you can find those courses at strongprocess.com.
Awesome.
Yeah, thanks so much for joining us today, Rachele. Really a pleasure of ours to have you on and to hear all the things that you're doing and learn just a little bit of the vast knowledge that you've acquired over time. So thanks so much. This episode of the Medical Fitness Podcast is brought to you by the Medicine, Rehab, and Fitness Institute. The MRFI has been co-founded by medical, rehab, and fitness practitioners who see the medical necessity in getting people to be more active and fit. There is a sleeping giant of opportunity to building a more active population, an opportunity which lies in a more effective medical referral pathway to exercise programs and professionals equipped to serve that pathway. To learn more about our services and how we're working to make this a reality, visit mrfinstitute.org. That's mrfinstitute.org.